Hi, I'm Dr. David Chang. In this segment, we're going to be discussing about why tooth gets sensitive once you have a filling done. Generally speaking, the tooth are going to be asymptomatic once you have a filling done, but in some cases, it may be sensitive and the sensitivity could last for a couple of days and maybe a couple of weeks. But if it goes beyond a couple of weeks, then we have to look at what are the causes that may be at work here. The other day, the patient came to the office seeking a second opinion as to why the tooth is still sensitive after having a filling done. Most of us, as a dentist, will have experienced occasional cases like this. It's not uncommon for most dentists to have experienced this. The cavity itself induces a certain amount of trauma, pain, and discomfort on the tooth itself. The physical process of removing the cavity itself introduces a certain amount of inflammation. Very similar to when you get a small cut on your finger or your hand, you have a certain amount of redness and swelling. When we have persistent discomfort after the filling is done, we need to look at biological causes versus physical causes. For biological causes, we are looking at the size of the filling, the depth of the filling. And in other words, how close is it to the nerve? If it is closer to the nerve, that means there's a greater chance of inflammation on the nerve itself. And the other one would be the plaque. The plaque contamination could be an issue because sometimes the tongue is very active. So therefore, the tongue may come up inadvertently and, we may not even be realizing that the saliva has been onto the surfaces that we are treating. For the physical causes, what are we looking for is that what does the remaining tooth structure look like? In other words, is the remaining tooth structure fairly thick or is fairly thin? For fairly thin tooth structure, there's going to be more flexing and movement of the remaining tooth structure. Therefore, the movement itself can cause induction onto the pain receptors that are located on the tooth itself. Move on to look at other causes. The other causes could be fracture. You could have a micro hairline fracture on the remaining tooth structure wall that may causing some micro movement and flexing. You could have a void in the filling material itself that could create some, again, micro movement as well. You could have what we call a micro gap. Micro gap is essentially a gap in between the filling material and the tooth structure, and it is a physical property of the material itself. Most of the filling today are done in composite. Composite comes in a semi-solid state. Semi-solid state allows the dentist to be able to adapt the material onto the preparation of the cavity itself. In order to convert from a semi-solid state to solid state, curing light is used. In the process, what happens is that the material actually shrinks a little bit in terms of going from a short polymer chain into a long polymer chain. So because of this shrinkage, it actually can pull on the remaining tooth structure wall, again, depending on what the thickness of the remaining tooth structure wall may be. C factor is looking at the number of bonded versus the unbonded surfaces. So therefore, if you have more bonded surfaces, it tends to pull the remaining tooth structure and cause some micro movement. So depending on the size of the filling you have and the surfaces you have, it may be a factor in terms of the tooth being sensitive. If you're still having some sensitivity after 1 or 2 bite adjustment, then we can probably conclude that bite is not really an issue there in this situation. Then we have to look at the remaining factor. Now, the remaining factors are all based on microscopic movement of the remaining tooth structure wall. The best thing to do is probably to go ahead and replace the filling at this point in time. What if you have pain and discomfort after the replacement? Then you probably need to wait for about 90 days or so. At that point in time, the dentist will decide whether a root canal is a necessity at this point in time. This concludes our discussion on why tooth gets sensitive when a filling is done. I'd like to thank you for your support, and please share the video with someone who may benefit from it. If you have any question, please contact us at www.drchang.com.